Assalamualaikum. I'm Shara Isangkula. So my report is about epistaxis or nosebleed. Introduction. So learning objectives. We have identify epistaxis, identify patients at risk for epistaxis, identify the pathophysiology of epistaxis, identify clinical manifestation related to epistaxis, identify assessment and diagnostic findings related to epistaxis, identify the medical management, and identify the nursing management. So definition, what is epistaxis? Objectives number 1, identify epistaxis. So epistaxis, a nosebleed is bleeding from tissues inside the nose or nasal mucous membrane caused by broken blood vessels. And who are at risk of epistaxis. Objectives number 2, identify patients at risk for epistaxis. So we have local infections such as vestibulitis, rhinitis, rhinosinusitis, and systemic infections. We have scarlet fever and malaria, and drying of nasal mucous membranes, and inhalation of corticosteroids or beclomethasone or illicit drugs or cocaine, and trauma such as digital trauma, blunt trauma, fracture, forceful nose blowing, and arteriosclerosis. So arteriosclerosis means a disease in which the walls of arteries become thick and hard so that it is difficult for blood flow through them. And hypertension means a high blood pressure. And tumor such as sinus or nasopharynx, and thrombocytopenia. Thrombocytopenia means a persistent disease in the number of platelets inside the blood that is often associated with hemorrhagic conditions. And use of aspirin, liver disease, and Rendu-Osler-Weber syndrome such as hereditary hemorrhagic telangiectasia. So the pathophysiology is objectives number 3, identify the pathophysiology of epistaxis. And most nasal bleeding is anterior, originating from a plexus vessels in the antero-inferior septum. Less common but more serious are posterior nosebleeds, which originate in the posterior septum overlying the vomer bone or literally on the inferior or middle turbinate. And clinical manifestation. Objectives number 4, identify clinical manifestations related to epistaxis. So on here, what are the symptoms of a nosebleed in a child? The main symptoms of nosebleed is blood dripping or running from the nose, and bleeding from the mucous membranes in the front part or anterior of the nose comes from only one nostril. Assessment and diagnostic findings. Objective number 5, identify assessment and diagnostic findings related to epistaxis. So in here, presumptive treatment for actively bleeding patient is that for anterior bleeding, and the need for blood replacement is determined by the hemoglobin level, symptoms of anemia, and vital signs. Any identified bleeding disorders are treated. And medical management. Objectives number 6, identify the medical management. So in here, treatment to be considered include the topical vasoconstriction and chemical cautery, electrocautery, nasal packing such as nasal tampon or gauze impregnated with petroleum jelly, with petroleum jelly, and posterior gauze packing, use of a balloon system, including a modified Foley catheter, and arterial ligation or embolization. And the nursing management. For nursing management, objectives number 7, identify the nursing management. So, instruct the patient to avoid exerting herself, forcefully blowing her nose, or bending over. And she should also avoid alcoholic beverages and smoking for 5 to 7 days, and tell her to apply water-soluble ointment to her lips and nostrils while packing is in place, and to use a cool mist room humidifier. And that's all. Thank you.